The main way to treat mold illness is with binder medication. So, as mentioned earlier, if you have CIRS, your immune system can't remove mycotoxins. It will try to remove them through bile, which it releases into the intestines, but it will get reabsorbed into your body through the digestive tract. So, the binders work by binding to the toxin more strongly than the toxin binds to bile. And so then it is excreted via stool. So, this is why it's important to ensure that you're maintaining regular bowel movements while you're taking binders, because if you're not excreting it, it can cause the toxins to reabsorb into your body. There are many different binders that you can use, but the best one is a prescription called cholestyramine. It is often used to lower cholesterol, but it is considered the best binder because it's similar size and the opposite charge to the toxins, causing it to bind really well with it. However, as I said earlier, different mycotoxins can bind best with different binders. So there are some natural binders, such as activated charcoal, clay, and I even know someone who's used steamed kale as a binder. I just went straight to the hard stuff. I really want to just get this out of my body. So I use Question Light, which is still cholestyramine, but with different fillers. And this version is significantly cheaper than the compound or pure version of cholestyramine. Question Light is $44 for a pack of 50 sachets in Australia, while the compound version is roughly $300. So, for those who don't know, a compound pharmacy is where they have a lab at the pharmacy and they make the drug in the lab on site. And so, this is why it's a bit more expensive. But some people are really sensitive and they can't handle the fillers that are in Question Light, so they have to get the compound version. Mold toxicity is really closely linked to multiple chemical sensitivity. So it's actually really common for patients of mold toxicity to be extremely sensitive to medications. And so it's not uncommon for people to have to start with like 1/16th of like the normal dose or even less. Dr. Neil Nathan talks about this a lot in his book Toxic. So really recommend that if that's you. Other people also are a bit iffy with Question Light because it contains the sweetener aspartame, which some speculate is associated with cancer. So I'm actually taking a mixture of three binders. I'm taking cholestyramine, clay, and one that's from a brand called Cellcore. However, be careful with anything you take, as citric acid is often derived from black mold and is in a lot of products, so you have to be really careful. Okay, so reactions. It's actually really common for people to have really bad symptoms when taking binders. So, if a reaction appears to be an exasperation of your current symptoms, it indicates that the binder has pulled the toxins into your body faster than the compromised detoxification systems can clear them. So, basically, what this means is that the binders have gone into your body, they're taking the toxins out of your system and they're bringing them up to the surface to excrete them. However, sometimes we have blocked detox pathways, and so they can't get out, and this causes you to have a heap of symptoms. Pushing through this does not make you heal faster. It's really bad to push through things. It'll make things worse and set you back. So if you're taking binders and you're having bad symptoms, back off, back off the dose. I'm going to go into detox pathways. So, binding is only half the story because once the binders pull the toxins out of your system, you then have to detox them out of your body. However, the toxins themselves often poison the very systems needed to remove these toxins, such as the lymphatic, the kidneys, etc. So, as a result, it's really common for mold patients to have reactions to binders as the medication brings these toxins to the surface, but they have no place to go. So, it's really important for patients to optimize the drainage pathways. The best way to do this is to sweat. So, exercise is good if tolerated, and so is going to the sauna. So I'm currently going to the sauna somewhere between 3 to 5 times a week. Other methods include dry brushing and rebound trampolining, which is just jumping on a little trampoline every day, as these will stimulate the lymphatic drainage system. So, I did experience this. I experienced really, really bad flare ups of chronic fatigue, and they just left me absolutely bedridden and worse than I've had in years. And also some pretty bad bouts of depression. And it was pretty scary, to be honest. It's like I had a mental flashback of where I was at that place. So for me, my mistake was I increased my binder dose too quickly. I started on half a sachet in the morning and half at night. Then I quickly went up to like one in the morning, one at night, one and a half, two, two and a half, three, which is like six in total. And it was just way too much. It was silly. I did all that in like a week. So, but I'm pretty headstrong sometimes. I'm like, I just want to get better. Yeah, big mistake.